Hi, I'm Donna Dowell, board certified family nurse practitioner and part of a growing number of healthcare professionals in New Mexico in support of the New Mexico Health Security Plan, a plan that will ensure comprehensive, quality healthcare coverage for New Mexicans. Healthcare under our current system is challenging for many. This short video is part of a series that features the personal healthcare stories of real New Mexicans, stories you will recognize as all too common.
Okay, so my name is Max. I live in Hillsborough in Sierra County, and I have a little story about medical problems and the insurance and my doctors and the whole system that we seem to be living in. Uh, I had a um, I had a heart attack a few years ago because I had eaten too much saturated fats, namely eggs and pigs, in my life. And as a result of that heart attack, I have been worried about getting a stroke. I mean, that's the last thing one wants to do is get a stroke and be a vegetable for the rest of your life. So I became somewhat alarmed when I started getting dizzy spells because I thought, well, this might be sort of like little mini strokes or something like that. It was like I almost passed out every now and then. I think it's in medicine, it's called syncope. And so I called my cardiologist, and uh, I, of course, you can't speak to the cardiologist, to any doctor on the phone. And so I was transferred over to the nurse. And of course, you also cannot speak to the nurse. So I left a message on her phone saying, look, I know you people have a sonic scanner for an ultrasound scan of the arteries in the neck, and that could give possibly an indication of how clogged the arteries in the head are and what my chances are of getting a stroke in the near future. I left this message over a month ago, and the nurse has not called me back. But in the meantime, after about a week of waiting, I called my cousin, who is a doctor, and I told him the story and I'd asked him what to do. And he said, Max, you just blew it. You never call a doctor and say, you think you have such and such. You never self diagnose. You don't ask for a test. You don't suggest anything that the doctor can do because the insurance will never pay for that. The insurance insists that whatever initiative is done by the doctor comes from himself and or herself and not from the patient. And so you've just cut off a way of getting a test. So he said, go to your general practitioner and see if she can open the doors for you. But do not say that what you think you have. Do not say that you're looking for a test, a specific kind of test. Just say that you have dizzy spells and you're worried. And so then you lay it on her because she then thinks immediately that if she doesn't do the right thing or get the right test for you, the other insurance problem kicks in for her, which is that I might sue her for malpractice if something goes wrong later and she doesn't attend to my worries. So I called my doctor, and it, and again, I of course had to leave a message for the nurse, um, and I said, look, I'm terribly worried. This is going to, I'm getting these dizzy spells. What can you do for me? And indeed, the nurse did call back, within a day or two. And she said, well, I've talked to the doctor about your condition, and she suggests that you drink some water. I said, what? He said, yes, maybe you're dehydrated. I said, no, 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 no. I drink a lot of water every day. I'm very concerned about dehydration for older people living in the desert, et cetera, et cetera. And so I don't think that's a solution. And I think maybe we should talk about this, or you should go back, talk to her about it. And the nurse said, well, if you have dizzy spells, you should call your cardiologist. And I said, but I called my cardiologist. I'm not getting any action from him. And she said, well, try it again and then call us back, and maybe we can set you up with a referral to an ENT, an ear, nose, throat specialist. I said, ENT, but why would you send me to an ENT? What is, she said, that's the procedure. I said, but I really am worried that I'm going to have a stroke, or that I might be getting, because I do have this history, et cetera, et cetera. And she told me that no. First, I go to the ENT to find out if I have a balance problem with the inner ear. Then maybe if that's negative, then I go the next step. Maybe I get sent to a neurologist to worry about my stroke. So this is the whole world that we live in, which is essentially governed by the insurance companies, and we have to play this little game constantly to make our way through it, because the insurance companies set the rules and the conditions for all these procedures, and as a result, we spend an enormous amount of money paying the insurance company to go through these procedures, many of which are useless. So that's it. That's the end of my story. Thank you.
Max's story. Neither Max's primary doctor nor his cardiologist scheduled Max for a visit to discuss his symptoms and to explore the vast number of medical diagnoses that can present with symptoms of dizziness and near syncope or passing out. Obtaining a comprehensive history from Max and performing a physical examination, including listening to the heart and the great vessels of the neck with a stethoscope, are standard clinical practice starting points in gathering clinical data to formulate a plan to address these worrisome new symptoms in a patient with a cardiac history. In the current system, reimbursements to providers negatively impact care priorities by incentivizing costly procedures, tests, imaging, and specialty care over other types of basic patient encounters, such as primary care, patient education, and episodic care for new or chronic problems. Encounters wherein a patient can share his symptoms, worries, and needs with a provider who knows him and his medical history is the kind of basic care that is poorly coordinated, undervalued, and poorly reimbursed in the current healthcare system. Health Security will provide more robust reimbursements to medical providers for low-tech, high-touch patient encounters, such as primary care, episodic care for issues that arise, mental health, case management, and chronic disease management like heart disease. Predictable reimbursements will help recruitment and retention of a healthcare workforce at all levels of care and across the state of New Mexico. The New Mexico Health Security Plan ensures comprehensive, quality healthcare coverage for New Mexicans, regardless of income, health status, or employment, provides choice of providers and hospitals, coverage extending across state lines without network restrictions. How can you help? Become informed at NewMexicoHealthSecurity.org. Sign up for campaign alerts or donate to the campaign. Contact your New Mexico state representatives at nmlegis.gov. That's nmlegis.gov. Tell them to vote for the New Mexico Health Security Plan. Tell your own healthcare story at NewMexicoHealthStories.com. Contact us at nmhealthstories@gmail.com. Spread the word. Forward this to your New Mexico family, friends, colleagues, and neighbors. And thank you so very much.